Hi and welcome to the channel. Today we're gonna be looking at pelvic inflammatory disease. That's the pathogenesis of pelvic inflammatory disease. So, pelvic inflammatory disease is a clinical syndrome caused by ascending infection from the lower genital tract, that's the vagina and cervix, to the upper genital tract, that's the endometrium of the uterus, the fallopian tubes, ovaries, and pelvic peritoneum. It is actually a clinical syndrome because it presents with diverse signs and symptoms. Now, infections from the vagina or cervix would eventually move into the upper genital tract, that's the uterus, the fallopian tubes, the ovaries, and the pelvic peritoneum, causing inflammation. Now, what are the causative organisms in pelvic inflammatory disease? Neisseria gonorrhea and Chlamydia trachomatis are the most common organisms in PID. Others may include Mycoplasma genitalium, anaerobes, Gardnerella, E. coli, and Haemophilus influenza. Rarely, you may see Mycobacterium tuberculosis. That's when there is a hematogenous spread. So, what's the mechanism of ascending infection? Now, there's usually a cervical infection known as cervicitis, that's inflammation of the cervix. This would lead to loss of mucous barrier. The loss of mucous barrier would finally cause the ascension of the infection into the endometrium, resulting to endometritis. Organisms ascend into the uterus, causing inflammation of the endometrium known as endometritis. Organisms will further move into the fallopian tubes, causing salpingitis, which is inflammation of the fallopian tubes. So, this inflammation and destruction of tuber epithelium will further move into the ovaries, causing tubo-ovarian involvement. This will result into abscess formation. This wouldn't stop here, as it may enter the pelvic peritoneum, resulting into pelvic peritonitis, that's inflammation of the pelvic peritoneum due to its spread to the peritoneal cavity. So, what are the contributing factors to PID? Multiple sexual partners, age less than 25 years, previous pelvic inflammatory disease, recent intrauterine device insertion within 3 weeks, douching, that's the use of chemicals like soap to wash the vagina, high risk sexual behavior. So, what are the pathophysiological changes in PID? There is intense inflammation resulting into edema and necrosis, fibrosis and scarring of fallopian tubes, adhesion formation, possible abscess formation. So, what the sequel does, the complications resulting from PID. First is infertility, chronic pelvic pain, ectopic pregnancy, and recurrent pelvic inflammatory disease. Thanks for listening, and do not forget to like and subscribe for more videos.